Good afternoon, everyone. Welcome. Welcome to Home-Based Childcare Network, supporting family, friends, and neighbor providers. This is part 2. Please go take a minute to introduce yourself in the chat box, where you're from, your name, and we're going to launch a poll to see what part of the home-based childcare sector you are a part of. Okay, I'm going to end the poll, but please feel free to continue to put that information in the chat box. See that a lot of individuals are from support organizations or coaches and technical assistants, as well as pretty even balance of system administrators, providers, and some other roles. So welcome. My name is Danielle Fuentes Johnson. I'm with the Build Initiative, and myself and Gina Capito are your hosts today. This is the latest webinar in a series of home-based childcare webinars that began in June through the Build Initiative. And this is the second part of our discussion on supports for family, friend, and neighbor providers. We have had a remarkable response in registration to this topic, which just shows how many of you are so interested in supporting family, friend, and neighbor providers. We do want this to be an interactive session, so we'll at different times, we'll invite you to participate, to either come on screen and unmute yourself at that point. Today, we're going to hear more examples of supporting supply and quality in family, friend, and neighbor care, as well as how a program is understanding and meeting the needs of family, friend, and neighbor providers. And you'll want to stay until the very end when we share a very exciting opportunity. So now we are going to take a moment to connect, and we're going to say, have you been pleasantly surprised by anything lately? This is a time to come on camera or write in the chat box, and we'll share out on your behalf. Not a time to fix anything, but just to be seen and heard and held for a moment in this moment in time. And when you're finished sharing, if you could indicate that by saying I'm complete or my share is complete, that would be great. So what has been pleasantly surprising for you lately, or since we last met? We have in the chat box that some providers are doing really well in working on their QRIS application, even though the pandemic is making the work harder. That's definitely uplifting. Would you like to come on camera and tell us a little bit more about that?
No, my camera isn't working, but I'm happy to share. I work with providers in Arkansas, and we have a big push for moving from the moving up our quality improvement chain, and that happened right before the pandemic, and some of them have just been really, really inspirational about it, even though we know that they're going through a really hard time, but they're dead set on doing well and providing better care and learning everything they can. And it's really inspirational knowing how much of a struggle it can be to work during COVID and maintain your staff and maintain families and maintain your income. And then they're still working on all this other stuff. It's pretty amazing.
Thank you. I really appreciate you giving us a little bit more feedback about what's happening in Arkansas. We have additional feedback that you've started an outreach for first training and are excited and have 6 family, friend, and neighbor providers who have registered. That's phenomenal. Can you tell us what state you're in or community?
Good morning. My name is Clara, and I'm from Fresno, California. I'm going to do it'll be a 6-hour, 2 hours each Zoom training on effective adult and child interactions. And we've been reaching out through our subsidized departments around the county. And we have 6 people who we consider true FFNs that we have never worked with them before. They've signed up for our training, and I'm pretty excited about that and hoping to get more. So it's a nice little, it's a step in the right direction.
Thank you so much. I really appreciate that feedback. Absolutely. We have from Nebraska that legislation was passed allowing family child care providers to access our tax credit. Fantastic. Well, thank you all so much for starting us off the right footing. I'm going to turn the meeting over to my colleague, Gina Capito, to remind us of what we learned on our last session and introduce our first speaker for today. Gina?
Thanks,
Danielle. I also want to go ahead and just share one more thing that came into the chat on something that's pleasantly surprised Donna as well, regarding social media networks and how FCC providers have been supporting each other. I think this is something, if I reflect a little on what has been not just recently, but kind of been a pleasant surprise of this whole experience all the way back to March, has been the ability for these platforms and the webinars to be supportive peer-to-peer in a way that maybe we didn't necessarily, when we say put forward a webinar and we say, okay, we're going to share good information on how to better engage family childcare, how to do more supports for home visitors. We didn't necessarily think about the how the network of peers would develop and support each other in ways that we couldn't have built slides for. And that's such a huge testament to the capacity of each of us as individuals to be support for each other and reinforce that idea that we're not alone. Even in the isolation, we are actually not alone. So I've been really pleasantly surprised, and I wanted to raise that up since Donna shared it in the chat as well as something. So I think that these platforms, as much as they're not always what we have as our first choice, there is a lot that we can do with them as far as chatting and sharing with each other. And that is something we've seen across this webinar series since we picked back up in June and have been doing content specific focus and discussion on family childcare. We've also done those sort of connect or let's share, where we just kind of share something that's going on and reflect on something that we're experiencing in the moment, and then also really allow for the chat to be a place for discussion to occur across you as well, to share strategies and ideas with each other, as well as be a place that you can ask questions that we can then pose to the speakers. So we want to continue to encourage that you can use the chat for sharing your great strategies with each other. So it is a parallel process that we're not just learning from our speakers, but we're also learning from each other in the chat and through our dialogue. So into that, we are really in part 2 related to family, friend, and neighbor care, and probably we'll have parts 3, 4, and 5 and continue this thread throughout all of our work on supporting home-based providers, because it has been such an area of interest and demand for you all across your states and communities, and the desire to really think strategically and leverage up good examples of how to engage with family, friend, and neighbor care providers. And we know there's a lot of differences across what's available to those providers within your states, whether or not they're funded by public dollars. There's a lot of variances that we all work across. And so bringing multiple examples of strategies, we believe, is one of the ways that's most supportive for us to sort of think, okay, maybe not that I heard about from Arizona, but maybe this that I'm hearing about from a colleague in another state can come together into a strategy for what my state or community can do. And so our first session on this, which I guess was just in October. I'm not going to attempt to remember when the session was. It wasn't that long ago. And I know many of you were with us for that session where we had a deep dive into the Arizona-based Kith and Kin model of supports for family, friend, and neighbor care providers and the networks that they had developed across the state, and all of the elements and components of that, including how it's supported and resourced. So building on that, we wanted to bring a couple other examples of supports related to family, friend, and neighbor care that unpack some other components of how you engage with family, friend, and neighbor care providers. And so I'm going to ask Alejandra to share her video and take herself off mute. Alejandra, who is from the New Mexico Early Care and Education Department, is going to share with us some strategies that they have developed in the state recently related to increasing access under COVID, but just also going to just kind of talk about some of their other supports for family, friend, and neighbor care providers within New Mexico to start us out. And then we do have a second speaker, Jerry Stewart, joining us as well from California. So we're going to start out this morning or afternoon, depending on where you are in the country, with Alejandra.
Morning, everyone. Like Gina said, my name is Alejandra Rebolledo Rea, and I am currently the director for the early childhood education and care, and in the early childhood education and care department, which is brand new in July. And I am the division director for the early care education and nutrition division. Our names are pretty long, so it's good that they're written in front of me so I can remember all the titles and the titles and the long name that we have. I'm just going to give you a little bit of the background in our department. We are very lucky that we just transitioned into a new department. We have legislation in 2019 that actually enacted the creation of New Mexico Early Childhood Education and Care Department, so a whole cabinet level department dedicated to early childhood issues. So from different departments, what we did is we consolidated into one setting, one umbrella, programs like childcare assistance, childcare, all the licensing and the regulatory oversight. We have a perinatal case management program that is called Families First. We have all of our family nutrition programs, the Head Start Collaboration Office, home visiting, our Part C program, and our pre-kindergarten. So if you can see how comprehensive our department is, it gives you an idea about the resources that we brought to our field and to be able to support our programs with a dedicated team that just focuses in early childhood issues. I just wanted to let you know that because we are able to do a lot of things, even though we're in the pandemic, even though we're still in transition to a new department, we're very excited about all the things that we were able to do. So one of the things that we want to remember a little bit is that on March 11 in New Mexico, our governor, Michelle Lujan Grisham, actually was when she declared the official public health emergency. And with that, we were able to activate a lot of pieces and problem solve in a lot of places of what to do to support our families. So one of the most important things that were part of that order was to deem childcare as an essential business. That was very important because that allowed us to keep our childcare doors open, to continue working with flexibilities, and to really look at what do we put in our New Mexico childcare emergency preparedness plan, and what other flexibilities are there for us to really meet the needs of our community. At the beginning, we were only providing childcare to essential personnel. And from there, as more businesses started opening, we were able to actually open more and more childcare to more and more families. But what we found out is that we couldn't have enough childcare open in our communities, particularly in the rural and frontier areas, to really meet the needs of our families. And on one hand, we had a huge need of families that normally are not in childcare. And on the other hand, we didn't have the resources because even though childcare stayed open, a lot of childcare programs chose to close their doors because they didn't have staffing, because families were not coming, and there was a lot of fear going on around. So that's what we started establishing the temporary family and friend and neighbor childcare program. So in New Mexico, we always had different levels of paths to come into the childcare, to be a childcare home provider. We have our licensed providers, and they have a set of regulations that they have to follow. They have to meet zoning and etc. We also have the registered providers, and these are providers that are license exempt, but they're still going through some sort of registration to meet the federal requirements for childcare reimbursement, to meet CSCFP requirements, and to also ensure that there is some sort of oversight where our team goes and does some of their health and safety inspections. But in addition to that, what we started doing is coming through another path, which is the temporary friend and family and neighbor. What we do for that is we wanted to make sure that we had a path that expedited the process of registration, because the register approach does require a visit from a registry oversight team. It also requires them to do a certain level of training, and it requires them to take several steps that can take some time, and it could be also an expenditure for providers. We wanted to expedite the process, so we started doing some thresholds on who can be registered as a temporary provider. So the first thing we did is that, still the exempt threshold that we have in New Mexico, up to 4 children that are not residential children that they can be caring for. They will be actually able to obtain, and that was the part that we were very interested on, is ensuring that they could qualify for the Child Care Assistance Program and also our CSCFP. But in order to do that, they needed to have the state background check requirements. That was non-negotiable. We wanted to make sure that if we had children that we were registering to be part of this particular facility or home, they needed to meet those requirements for background checks. So what we did is we started paying for their background check and facilitating the background check process for anybody in their household over the age of 50. So we were able to do that. And also we provided the first aid CPR training online for free so that they could also meet those requirements. And then in lieu of our visit, our physical visit to oversee the program, We actually did a self-declaration that was done in conjunction with the families, and together they did a health and safety checklist type thing, and where the parent actually certifies that they have looked at these things and they meet those requirements. So it was more a partnership between the parent that was receiving the care and the caregiver. So with that, if you can go to the next slide, what it allowed us to do is to have a more flexibility when it came to respond to those high need communities. So now how do we get the word out, right? We have this very cool program. We have this very cool opportunity. What are we gonna do to make sure that in the times where we're all isolated, we're all in screens, how are we gonna get the word out? So we started looking at our different partners. A very natural partner, of course, was the New Mexico Public Education Department. We actually had an agreement where we were working with some of the regional education cooperative offices that were working with childcare programs and with schools to start finding out some resources for families that whose children needed care, but the schools were not providing on-site learning. So it started actually one of those opportunities to bring them together and to work with the public education to get the word out. And actually they help us recruit some of those home providers that met this category. We work with the New Mexico Hospital Association. Again, we were working with essential personnel and emergency personnel. So they were very good at helping us problem solve how to take the word out. Our CSCFP's food sponsors are actually working already with homes. And so they help us recruit through word of mouth, some of those providers in the communities. Workforce Solutions, when they were doing their announcements and their press releases, they were able to mention this as one of the options. And of course, we have our resource and referral agency that continuously working with families who are looking for childcare, providing this as an option. We wanted to make sure that it's very clear that we also have in our department, we have our early childhood education assistant secretary who's focusing on the Native American early childhood care. So we have a tribal connection very close in our communities, really working with the tribal communities as well. And of course, our governor, every time she talks about the importance of childcare, she talks about all these options. So we're very lucky to have a governor that supports early childhood programs as much as she does. So
Alejandra, can I hop in with a couple questions before you move to the next slide? Just a couple things that are specific to a few of the things you raised. One is whether or not the temporary FFN providers are watching children in the children's home or in their own home.
That's a very good point. Thank you so much for that. In order for them to qualify under this category, the care is provided at the childcare provider's home. It's not in-home care, but it's actually more like a home provided traditional, away from home. Yes.
And then this may be still a little bit of early days, but another question is which of the outreach modalities that you were just sharing seems to have been the most effective in recruiting?
Probably none of the ones that I just listed. Is mostly word of mouth because it's such a small community and one parent will tell the other.
The direction it's going in.
The biggest one, of course, was these regional education cooperatives with a partnership with Public Education Department. They were actually working very closely with the children in the public schools and our resource and referral, because families are calling desperate finding childcare, and then they provide this option for them. So those are the two big ones, yeah. And we continue providing that information. We're about to launch another media campaign to attach to our current media campaign. We have a media campaign in New Mexico to promote early childhood healthy development through Moments Together. So we're gonna do a spin-off of that campaign to talk about childcare, and this is gonna be part of our message.
Alejandra, one other sort of reflection. I was thinking that idea of the home safety review, especially because of the virtual nature of having to do it, having the parent engage in doing a home safety review of the provider that they're utilizing is such a smart way to have it be about a partnership between the parent and the provider. Have you seen any reflections from parents on that experience?
We have had some feedback from some of the parents, and they were a little bit more seeking some TA, like, am I looking at the right thing? How do you interpret this? Because they were taking their role very seriously about being advised consumers and really knowing that this is a very big responsibility, because now somebody else, a third party, is not determining this particular home to be safe, but it's a parent who is the one that is actually deeming this house to be safe. And so it was more a lot of problem solving and talking to them. And it seems like parents are feeling very empowered to be able to have that. But they do require some communication. It's not like, you know, that automatically they feel comfortable. There's some that no problem, is a relative of them, is their auntie, is somebody that they know. But in some cases, if it's a friend of theirs or a neighbor, they might want to look into it a little bit more.
So there's a few, there's a few more questions. There's lots of great dialogue in the chat. I want to note, before I ask Alejandra this particular question, that I think you probably are all pretty well aware that within your individual states, definitions around things like licensed compared to registered has huge variances across states. There's a question for you specifically, Alejandra, to speak to that idea of licensed compared to registered, and then how that compares to this temporary FFN category that you've started.
Correct. And I was going to leave it for the end to give you what are the next steps. But in New Mexico, traditionally, we only have two tracks for home licensing, for home registration or licensing. We have the anybody that is providing care for children, for more than 4 children, non-residential children, has to be licensed. And then if they exceed the 6 children, then they have a second provider. So we have different categories for when the home becomes licensed. But for license exempt homes, they can care up to 4 children that are not related. They don't have to register with us. We prefer that they register. And actually a few years back, we lost, and throughout the years, we have lost a lot of registered homes when we started requiring the background checks and we started requiring a little bit more oversight. There was a decline. And so what we wanted to do now is, with this temporary approach, is one, to meet the needs that this pandemic has created in our communities, but at the same time allow a path for programs to come into the register path. Because we want them to be registered, because there's so many resources once they become registered. And the cool thing that I was gonna leave at the end, the very, very new iteration of our state and what we're doing, we actually are putting in our regulations and formalizing this temporary approach. And we're using it as a 6-month temporary, and with the option of extending depending on the situation. But it allows us another path to bring homes in, where we pay for their background check, where the parent does the initial oversight, and then starts bringing them into the system, and we have 6 months to help them with the additional support that they might need to become registered. So that's what I was going to leave, the last icing. But one of the things that I'm not going to tell you anything that you don't know already, but one of the things that our home providers, particularly our registered providers, in this case, the temporary FFNs provide, is that they actually provide this opportunity to provide care within the community and meeting the community needs, like a family needs, the cultural needs, the language needs, their equity needs, somebody from their community. So once we have a provider that is in the system, it's just a very gentle way for us to include them in all the resources that are available. So we continue enhancing those resources in the community. So we want this program to continue. We want to continue providing those supports for our friend, family, neighbor, and eventually going through the registered path. And those that qualify for being licensed, they can be licensed and continue on with their path. But for us, we understand that even if they are not licensed, or when they are not licensed, they still providing a critical service to our communities. So right now we're doing some tracking to see where the FFNs are. We have actually 105 exceptions going on right now for that temporary registration. And what it does is giving us, we're trying to figure out where they are and looking at what the needs are and how does it look between our registered homes, our licensed homes, our centers, and now our FFNs. How are we meeting the needs of our state? By all means, it's not the one answer. It's part of many, many approaches that we have in our state, trying to address a lot of the concerns that we have going on. And as everybody that is here today is feeling it, we just feel that this is another resource for our community and of course for our families.
We also had while Jonathan's advancing, Alejandra, I'll just note if it's possible to share, and we can share this as part of the materials after the event too. Folks asked for the home safety checklist that you're using.
Yes, and it's right there in this link that you see it right there. Maybe if Jonathan can click on it, hopefully, fingers crossed, it's gonna go smoothly, but I did test it before I sent it out. It's actually the packet that you get when you are interested in registering. And I'm sorry, there's the information actually more about that, and then it gives you all the resources. So even if you cannot open it right now, it can allow you to if you go in on your own, you can click in it. It gives you like at a glance of what you need as a provider or as a family that is interested. And then it tells you everything you need, and you can click on those pieces, and it gives you the health and safety checklist and the application and the packet and everything else.
Would the media campaign that you've used be there too? That was another resource request that we got.
Yes, the media campaign is called Moments Together. And we are finalizing the childcare piece. It's not finalized yet, so it's not public yet. And that's gonna include some of the promotion on the resources available, including FFN. Right now, our Moments Together is more about parenting and the bonding of the parent and the child, and taking advantage of any moment to really advance the development of your child.
So then there are a few more questions for you, Alejandra. Thank you all for being such active participants. There's a couple questions that speak to this idea of whether or not documentation issues for the providers, the FFN providers themselves, or their family members have been an issue, and how you've dealt with that. And then sort of tied to that some is the idea of issues are mixed status families more or less engaged. Have you noticed a pattern regarding that?
Yeah, so of course the immigration situation is something that is very sensitive for everybody, including our state. Our regulations for childcare assistance tells us that as long as the child qualifies and meet the federal status for citizenship or residency, we don't ask for the family status. We don't ask for anything else. And even our providers, we do have some providers that may or may not be documented. There is just certain documentation that is being asked for them. They have to do they have to do the paperwork to register. They do have to have background checks, but that doesn't stop them. I mean, as you know, the background check doesn't look whether you are a citizen or not citizen, but you do have to have a background check. So we don't go very deep into finding out if they are eligible or not eligible to be working. So if my grandma, who may or may not be documented, is the one that is providing care for my child, there is just a checklist that they having to complete, but citizenship is not part of that. Neither for the family. So if I'm undocumented and my child is a citizen, because the benefit is on behalf of my child is the one that registers. And
there's one other question while I have you for just one more second, is on the food program, Child and Adult Care Food Program, or CACFP, whether or not there were any issues with the temporary, are those providers accessing food program, and just how you might be leveraging that resource? Yes,
so if you were to look at the steps that these FFNs were taking, the first one is getting registered, right? And that was the first background checks, and then the application form and the health and safety checklist. When they register, we send the information in the database. When they apply for CSCFP benefits or to be a CSCFP provider, the CSCFP being under the same umbrella, using the same system, they just double check and make sure that they meet the requirements, that they are a register that is deemed registered by a regulatory oversight unit. And once they are approved to participate on CSCFP. And again, they don't have to be documented. The children that were participating in CSCFP, as you know, they do not have to be documented either.
Apologies for the interruption, but I just wanted to double check that because the home-based care provider is registered at like state level, and I guess in a certain extent license exempt, it's the state, in a sense, that's acting like vouching for the care provider as in lieu of having them licensed?
Yes, Fernando, thank you for the question. So anytime we register our providers, whether they are registered through the traditional path that I mentioned earlier, or through this new shortcut, which is the FFN provider, we are certifying that this person meet the requirements for that category, and that's what CSCFP will be going after. So in New Mexico, in order for them to participate in CSCFP, they have to be either registered or licensed. So this actually takes care of the registration part. Yeah. And
Thanks,
I just put the link to this resource in the chat box too.
We will also gather all of the links, and all of the things will come together and be available through the Build website. I know that a few folks followed the link that I had shared about 10 or 20 minutes ago and found that you're getting an error. I believe that right now that it's a temporary thing, that Build site is having a problem, but the link is still the right link. So I'm exploring that, and I'll get back to you all in the chat on that. There's a few things going on at the same time.
Yeah. Danielle here. I did reach out, and Build is aware and is working on that. We hope to have it resolved ASAP, and we will make sure that the recording, the PowerPoint, and the resources are shared to you all, either via the website, or we'll send out an email, but you will have access to these as soon as possible.
And I just saw a question, what happens after the 6 months? So two things happen after the 6 months. If we're still in the pandemic, then it automatically will renew as long as we're done with all the pandemic and we are no longer in an emergency status. But we do have to check in with them and make sure that everything's still okay. And so we will do that check-in. In the regular path that we just put in the regulations is that after the 6 months, if the provider is working on the registration, we can extend that until such time that the registration is complete. But if they're not, we just let them know that in the 6 months, the registration will end. So they have the choice, unless something happened that they need to extend the time, we are allowed to extend the time. But for the most part, we do want them to become registered within 6 months. So which means that somebody from our staff will go and visit them. And of course, we will not wait until the 6 months and say, I'm sorry, time's up, goodbye. But we're actually gonna be checking in with them and make sure that they have all the resources to go through the registration path.
Thank you, everyone. This is great dialogue and discussion. I want to share as we transition. There was also a question about training and supports for the temporary FFNs, and thanks to colleagues for sharing with each other some of the training that you're doing in your state. There's also a fair amount of content that Jerry's going to be bringing us on this idea of training and supports for FFN. So in the interest of time, I'm going to transition us to Jerry. And before we do that, just wanted just to prompt out there for you to share other strategies that you may be using in the chat on ways to move and kind of understand this pool of providers, right? We acknowledge, as Alejandra said, that some of these providers are grandmas and aunts that maybe aren't interested in becoming a part of that pipeline of supply for childcare in your state, but some of them are. And what strategies or ideas have you found successful, or are you working on that help you to think about this idea of, like, how do you find the ones within the pool of FFN that may be on a path to become a registered and then become a licensed provider? Are other folks working on these same ideas? And anything you can share in the chat would be great. I'm gonna leave that one to be a chat interaction, because I believe that you're gonna also have a lot of questions and dialogue with Jerry too. So I want to be able to give as much time as we were able to keep Alejandra on the hot spot with Jerry too. So I'm gonna turn it now to Jerry Stewart, who's with the Child Care Resource Center of California, and she's gonna talk more about their specific models and supports that they've developed out for FFN providers.
Thanks, Gina. So I'm super excited to be here with you all today as we talk and think together about supporting FFN providers. I thought I'd start today by sharing a little bit about my own childcare experience, and hopefully if you haven't already, you can take a moment to reflect on yours as well. So when I was growing up, if I wasn't in school and my parents were working, I was cared for by my aunts, uncles, and grandparents. And then fast forwarding to years later when I became a parent, thinking all the way back, I always chose FFN care for both of my children, who are now 15 and 19 years old. So big kiddos now, not so little anymore. I joined CCRC when my youngest child was starting kindergarten, and for the last 10 years, I've had the privilege of overseeing lots and lots of different programs here. So as you can see on the next slide, we are a large agency. And like many of you, we partner with parents and providers and other early learning and care professionals in a variety of ways. So you can see here, super large service area, close to 1,000 employees, and every month we serve over 50,000 parents, providers, parents and childcare providers every month. So before we dive in, I wanted to briefly describe just a little bit on how our FFN programs and activities are funded. Our two funding sources are state and grant funding. The state funding we use comes from the California Department of Education, or CDE, and historically we've also been awarded various grants from private foundations. One of the most recent grants that we've had that I'm most proud of was from the David and Lucille Packard Foundation, where we were funded 2 years to partner with one of the largest school districts in California, the LAUSD, to administer playgroups for FFNs and children 0 to 5 in their care. The purpose and the goal of that program was to see if we could support the school district in helping families to make a connection to the homeschool and the FFNs before the children entered school age, that they would be better prepared and equipped to support children once they entered school. So most of the activities we're going to discuss today are funded using state dollars. And what this means for me is that every day I get to come to work and ask myself, what else can we do for families? So for the bulk of my presentation, we're going to spend most of our time on this slide here talking about the different programs and how they work and the different things that we've done here at CCRC. So like most of our sister agencies, are in our agency, CCRC offers a wide range of services for FFNs. Everything from light touch activities, to hands-on individualized support. We offer drop-in sessions to cohort series. Our goal is really to come alongside the FFN providers and meet them where they're at, wherever that may be in their journey. Our outreach and recruitment efforts for all of the activities that you see listed here have always been ongoing and multifaceted. So you can see I categorize them all as outreach because these are all of the different ways that we connect, but some of them are super light touch and some of them are, we're going to meet with you individually on an ongoing basis and help support you to become licensed, for example. So all of our outreach and recruitment efforts for all of the activities, as I mentioned, have always been ongoing and multifaceted. We advertise all of the opportunities that you see here for playgroups, story times, cafes, workshops, our Sesame Street Learning and Growing Together curriculum, and our SIP program, which supports providers to become to open a licensed family childcare home. We advertise all of those programs on our flyers and our newsletters, just kind of cross-advertising everything, because if you may be attending one activity, there's a good chance that you're interested in another that could be of benefit to an FFN or the children in their care. So we really try to get the word out as much as we can about all the different things that we do. Another way that we conduct our outreach is every month we receive a list from Community Care Licensing of people who have attended an orientation to open a licensed family child care home, and also those who have become newly licensed in our service area. We also run an internal report from our provider database to see in the previous month what newly added providers, licensed exempt providers that were added that receive subsidies, so that we can outreach to them. I see in the chat, I'm from California. I'm from sunny Southern California. Which, today, I'm sure for some of you guys, it might be a little bit cold. It is pretty warm here. I have the windows open and a fan on. So yes, sorry, just saw that question in the chat. So right now what we're doing is when we do this outreach with the list that we get every month, we send an email like a news blast, and something that we've transitioned from is prior to the pandemic, staff would generally send it from their work email address. And we've transitioned to using MailChimp, because what we've learned with MailChimp is that once we send the email out, we can track to see who's actually opened the email. So that helped us to become a little bit more targeted in our outreach, rather than maybe making random outreach calls to providers. We could really look and see who opened the email And when we call them, we can follow up and say, hey, I'm so-and-so, I'm Jerry from CCRC, and I'm calling to follow up. I see that you received the newsletter that we sent and blah, 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 blah. So that's a new way that we've started to really be smart about how we're utilizing staff's time, because we know that they're so busy and there's so much going on, and providers have so much going on, that we really wanted to be intentional about how we did that piece of our outreach. So in looking at all of these activities that we do, things have obviously changed due to the pandemic, as I'm sure they have for all of you. Pre-COVID, all of our activities were in person, either at our offices or in the community. As you can see here in the picture, these are some of my favorites to show. This is one of our staff in our library at our headquarters, where I don't know if I don't remember quite if this was during a play group or just during open play time in our library, where our staff sit down at tables. We set out really open-ended activities for parents and FFNs to explore with the children. And then we sit down and just kind of do some modeling and sharing and get to know them. So, and getting together in person, having play groups, sharing food, sharing materials, all of those things that we used to do before have really changed now with the pandemic. So as you can see from the pictures on the right side here, we're currently conducting all of our activities virtually and coordinating drive-through events. So we went from being together in person to now we use Zoom, and staff are getting creative about what are the things that FFNs and other caregivers would have in their home to make our play groups and the opportunities that we're providing accessible and meaningful for these providers. We're not expecting everyone to go out to Lakeshore and spend lots and lots of money to do this. We're looking for things around the house and giving some pre-guidance of, hey, for our next session, you might want to, save a toilet paper roll. Do you have a yogurt container? Save a cereal box, and help to prepare them in that way for the sessions that are coming up. So what I like to say is that we're chameleons walking over a plaid blanket with the occasional somersault or backflip, excuse me. In other words, meaning flexibility and adaptability are key in all of this work that we're doing right now.
Jerry, can I present a couple questions that are coming in, and things that I think would be great? The outreach and the strategies that you use around like MailChimp and tracking, that's definitely something that folks are triggering into. And I was wondering about that flyer that you mentioned where you message more than one resource that's available to FFN, if that would be a sample that CCRC would be willing to share with the group, because I think seeing that could be useful for other states too.
Sure, absolutely. This is something new that I can follow up with you offline about that and then get it out to the group. Okay. So we didn't always have newsletters going before, but we found that because we weren't seeing our FFNs and our caregivers, our parents, as often as we would when we were in the office, we had to think creatively about ways to get information to them and to just to keep them informed and to keep that connection. So what we started with, it was a playgroup, a newsletter that we developed to accompany our playgroup cohorts that we offer. We share there's a little description of the activity. We share some tips for facilitation, maybe some open-ended questions to ask with the children. We talk a little bit about the learning that's happening behind the play, so that we're really focusing on process versus product, the importance of, that young children really learn through play, and that we know for young children 0 to 5 especially, it's really about that interaction and that connection with a caregiver who's tuned in and understands that child and is really there to support their needs. So that's how our newsletter started out. And what we're in the process of doing is adapting those so that we can spread it beyond just those participants that attend our playgroups, but we're adapting it where instead of it saying, hey, for next week's playgroup, get ready and bring these materials, it'll be the same activity, but we're trying to work smarter, not harder, and just change the wording to say, here's an activity you may want to try, with children in your care next week. So just kind of tweaking it a little bit so that if you're not attending a playgroup or whatever activities, it's still meaningful and beneficial and useful to them. So that's the newsletter that we developed. And then we have now digital versions of our Storytime flyer, postcards, and different promotional materials that we use. So we've plugged in a little hyperlink there to visit our calendar and learn, if you're looking at the Storytime postcard, there's going to be a reminder to check our website and learn a little bit more about our cafes and other opportunities that we have, and vice versa.
Actually glad that you raised the cafe again. Folks wanted to unpack and hear a little more about those FFN cafes in particular. So can you tell us more about that as a idea of engagement?
Sure. So here at CCRC, we have the privilege of we are the coordinators for California for the hubs for the preschool development grant. And part of that is working with other resource and referral agencies throughout the state to administer cafes in their communities through a hub system that we've set up. So for CCRC, what we're currently conducting are what we call Vitality Cafes through the Parent Cafe umbrella program. And this is a series of, I believe, oh gosh, I should know this, but I want to say there's 6 to 8 vitalities that the caregivers go through for each cafe. So we have 2 facilitators that meet over Zoom, and the first one of the there's physical vitality, mental vitality, and it's just a conversation that's really relevant to what's happening right now. But how are we all supporting ourselves and one another through the pandemic, so that we, how are we filling our own cups so that we can in turn fill the cups of the providers and parents that we work with, so that they can in turn give that support to the children in their care. So we offer them, right now we're offering them weekly in the evenings, and it's a mixed group. They're really open to FFNs and to parents in the setting right now. We're refining our processes and looking at how can we increase our capacity and build to offer more programming in the beginning of the calendar year. So the plan is that we will offer weekly cafes in the evening, probably around, we're looking at the time, but we find that 7 o'clock seems to work well for providers, because if they're caring for children till 6:30, generally they can get everyone, after the children leave home, they can maybe take a break and then log into the session. So we found that since the pandemic has happened, we've had a lot better response for weekday evenings, where prior in the office, we would do lots of things on Saturday mornings.
Some flexibility, right, with the pandemic.
Absolutely, yes.
There are a few other questions. One was on the most requested topics that you're finding from FFN providers.
Oh my goodness. Right now, we're getting lots of questions on how to support distance learning is a big one right now. That's something new that we're seeing. I'm just going to scroll a little bit in my notes here, because I don't want to, I did have some data here to share, but one of the points relevant to what you're talking about that I really wanted to highlight in my presentation today was that so we all know that FFNs, they're caring for a majority of children 0 to 5. And what we've learned recently through a survey that our agency put out recently to providers, where we had almost 800 FFN respondents, we learned that 75% of those respondents, just about 75%, self-reported that they're currently supporting distance learning for an average of 2 children per FFN provider. So, and this data just really supports what my staff are hearing when they, my staff are the ones that on here you see technical assistance. So when people call CCRC and want to talk to someone about resources or whatever's happening in the agency, that's really what my staff do. And what we find is that lots of requests for support for the caregivers that are supporting children who are doing distance learning in the home. And then also activities for young children. Lots of questions about how to, activities to do with young children while supporting social distancing and all of the guidelines that we're all following right now due to the pandemic. Was there another question, Gina? Or
yeah, so this one, I want to tie the question that's in the chat related to engaging with the CCDF funds to actually talking a little bit more about CSIP. So, and I'm not going to get the what CSIP stands for correct, and I know that not everybody is within California either that's on the webinar, so I wanted to bring us back to CSIP to describe it a little, but I think it will help speak to some of what Fernando's question was around how you're linking these providers or leveraging CCDF resources to support these providers and sort of moving them into the quality system, or even into licensing and then into the quality system. I think CSIP is a great example of that. And
Yes.
I'll turn it over to Jerry with the note that CSIP in part is funded by some of those CCDF quality dollars. So I think that that's a helpful connection there for folks if you're thinking about how California as a state takes some of those dollars and places them across initiatives.
Yes, thanks for that, Gina. So CSIP, or SIP as we call it, is the Child Care Initiative Project. And this is a program that the goal is really to support people to open family childcare homes. The goal is to increase capacity to serve children 0 to 5. So to be in the SIP program, we help people to open a family childcare, from the idea to we walk you through the application process. We conduct a pre-licensing visit with you, all for free, and give some guidance and support. And then in the SIP program, there's 25 hours of training that we offer, completely free, specific to having a family childcare home. So in that program, we do lots of things like what Alejandra mentioned before me, support with the cost of becoming licensed. We know that in California, every adult over 18 has to be cleared by Trustline. They have to have a background clearance, and that can get really pricey for some people, and that's a barrier to becoming licensed, or to it's just one of the barriers that we see. So we provide support in paying for the background checks, with the licensing fees, and then also with we provide free CPR and first aid trainings, and things like fire extinguishers and all of those things to help them to become licensed in the Child Care Initiative Project.
Jerry, I know that you spoke a little bit about when folks go to a licensing, like informational meeting, that they come into the state licensing system and then you get information on those providers. There's a question also, and I think this speaks to that outreach and engagement with family, friend, and neighbor care providers, that sort of how do they get on your list? Because if they don't go to that, if they don't go to a meeting to learn more about becoming licensed, how might you hear about them? And I know Alejandra spoke a little bit about word of mouth, and just curious what you find in your California community.
When Alejandra was talking, I was on mute, but I was nodding along that word of mouth, it's really what's going to get them in the door. And it's, in our experience, that's what gets the providers, that's what gets them to stay. When we can get the buy-in of one FFN, we know that they can see value in the programs and the services that we're providing. What does this mean for me, and how does this benefit this little person that's right here next to me, that I'm taking care of every day? That's what gets them in the door, and that's really what gets them to stay. So for us, like many of you, when we were out in the community and doing outreach events, backpack giveaways, partnering with our sister agencies for events in the community. One of the great things that I'm so privileged working at CCRC is in our county, in particular for LA County, we have an incredible network with the other R&R agencies where we meet monthly and we partner, we share ideas, we leverage opportunities, and really support one another in supporting FFNs, providers, and families, for all of LA County. So that's a strategy that I would absolutely recommend, is reaching out and thinking about, how can we partner and leverage our collective voice and strength to uplift FFNs. One of the ideas that came up in one of our meetings was, it didn't quite come to fruition, but we learned that one of the R&Rs in our service area partnered with the DMV and was able to have ads running, while people were waiting for their DMV appointment. They had an ad running promoting their resource and referral agency at the DMV. So we looked at things like, could we do Dodger Stadium and cover, for all of LA County and promote R&R as a whole and all the great things that we do. For our agency, we've done things like kiosks in the mall, having ads there. But one thing that sticks out to me, it really is that word of mouth. I think about one FFN, a grandma who started attending our play groups, and she had a 4-year-old grandson, and he was really slow to warm, and he was having a hard time transitioning into the group. He didn't want to sit for circle time. he wasn't really following along. And at the end of the grandma was very apologetic, and kind of at the end said, we're not going to come back because it's, we know that it was disruptive for him. So the staff, really encouraged her and used positive reinforcement. We did follow-up calls to really encourage her to come back the next session, and she did. And after a couple of weeks, what we saw was that one time at a transition, the staff person turned off the lights and told the kids, 5 more minutes until cleanup time. And the FFN walked over and she asked, why do you do that? And the my staff explained the importance of giving children cues and forewarning, and how that can really help in transitions. And the grandma was like, okay. I have to tell you, after that grandma came back week to week. She started inviting friends. We had, because she saw value. She saw something, she came back and she said it changed things for her at home. The tantruming slowed down, transitioning, from one activity to the next had become so much easier. And it was just something as simple as, why do you turn the lights off and on? She saw value and she wanted to, share that with others. So yes, all the things we do are important, but word of mouth is really how we get them and keep them.
All right, I'll let you dig back in because I know you had some more content, and then I'll sprinkle in more questions as they are coming. But go ahead.
Okay, sounds good. So getting into the logistics a little bit, I wanted to talk a little bit for those of you that may be contemplating or in the early stages of thinking about, how do we do this virtual? How do we take all these great things that we did in person and transition to virtual service delivery? So many lessons learned for us, and that we're still learning. But a couple of the things, the high profile things that kept coming up for us were equipment and techniques are crucial for your staff. If you're going to be connecting over Zoom, it's so important to know, do staff have access to Wi-Fi, and do they have sufficient bandwidth? For us, for example, we learned that, most of our staff had Wi-Fi at home, but not everyone necessarily had agency issued equipment. So while that was in process, some staff were working from their personal, laptops and computers. And what we found was that was a really fine line to walk and a delicate dance, because, that's when people's personal stuff, we don't know how old it is. We don't know how well it works. We don't know someone's personal situation. Do they even have Wi-Fi? Can they afford it? Can they afford the level bandwidth and speed that we all now need to work from home? So that was something that we learned, that bandwidth for streaming was crucial to ensure that our staff had enough so that when we're in Zoom, we don't drop out. Chromebooks, we've learned, have not been as useful for us when for the Zoom platform and for virtual service delivery versus the laptop. They don't have the same processing capacity. So that was one of the quick fixes. Laptops weren't available, but we were able to get Chromebooks for all of our staff, relatively quickly. But we're learning now that for those who train and as we're in Zoom meetings all day, and all week with our staff, those that have Chromebooks really are impacted, and it has impacted some of our training. So that's something that we are working on. We learned it's super important to stay current on guidelines and expectations for your state and county. For us, that meant attending weekly phone calls at the county and state level to learn about the guidelines, because they change often. And when we learned that new information, it was so important to share it often and share it widely with our staff, with our parents, and with our providers, with everyone in our network. And also to not just share it with our staff, but to make the time to answer their questions, because going back to outreach and retention, we want the FFNs, we want people to come to us and see us as a resource. We don't have to have all the answers, but we have to know where to go get them and then be able to follow up and get back to them with that. So staying current on the guidelines was crucial. We learned that some things that worked pre-pandemic needed to be revisited and adapted. So we went back and looked at some of our policies and procedures and made some temporary adjustments to support us in our work during the pandemic. Then we made sure that we gave it to staff in writing, and we have them as living documents on our shared drive so that we can update them frequently as staff change, and that if myself or the supervisors are in meetings, staff have somewhere where they can go and get the answers so that they can get back to parents and providers, as quickly as possible. And then the other thing that we learned is all providers, all FFNs, they come with their whole heart, and they just want to do the best that they can for the children that they serve, that they're caring for. Well, what we know is that they may not always be equipped with all the stuff they need to do the job. So we started thinking about, well, what are some kits that we can send out for participants in our playgroups or different activities? And what we, trial and error, we've gone through a couple of iterations, but what we do now is at the beginning of our playgroup cohorts, we send things like child safe blunt scissors, some construction paper, some glue sticks, some tempera paint sticks. Those are like the best thing ever. Those weren't in the classroom many, many years ago when I was there, but my staff introduced me to them and they're incredible. So we send things like that to the providers so that, we don't expect you're going to have scissors and construction paper and those types of things, but, we're going to ask you to, like I mentioned, to save those toilet paper rolls or things like that around the house that you may find. So we started out giving them some basics to get started, and then we built it in like a tiered incentive process where once they attend 6 out of the, if for those FFNs and participants that attend 6 out of the 8 sessions in the cohort series, there's another incentive built in where they will get like a, I think right now what we're doing this time is a set of bilingual board books for children. And then we're thinking about, something that's worked for us in the past is every session we've given out a raffle ticket, and everyone's name gets put into a raffle. So that as many times as you attend, that's how many chances you have to win at the end when we draw, we do the drawing at the final session. So building in those incentives really supports attendance and retention. So I talked a little bit.
I know you talked about the different funding streams, but just want to check because folks are asking about tech. Was there any particular funding stream that you were able to avail yourselves of to fund technology for providers and staff too? Is there any secret on that one?
I wish there was. That's something that we're still looking into now. We do part of our Family Childcare Home Education Network. I know that that's something that team is really looking at, is where can we leverage funding and find opportunities to provide providers with for things like headsets and computers for distance learning for children. So we CCRC, we're a large agency, and we definitely there are benefits there, and we haven't, how can I say, there hasn't been specific funding, but as an agency we have the capacity to as things become available, because so many things are back ordered, to get staff the equipment that they need using our existing funding. And I'm trying to think of the specifics. I'm trying to go to like one particular grant, but pretty much we look at where our office supply dollars or tech dollars, if those are, we use our, oh gosh, what is it called? The 10% de minimis for some of for the contracts. We use, those funds are used to support things like office space and all of those things like that.
Yeah, indirect, yeah.
Yeah, indirect, yep. Thank you. For last year, through the Child Care Initiative project, there was some additional funding. There was a SIP expansion grant where we were able to support providers with up to $1,000 each in incentives. And so up to June 30th, that was an option where we could use those funds to up to $1,000 per provider, where if they needed a laptop or something like that, those were things that we could provide, but we don't have that funding at this time. All right, so I think I'm getting pretty close to wrapping up, but I wanted to just share a couple of numbers that have really been encouraging to us. So we received some report of some data from the first quarter, this last first quarter, and I'm just going to kind of read through it because there's lots of numbers here and I don't want to mess them up. But we've had a total of from July to September of the current fiscal year, we had a total of over 400 FFNs, unique FFNs who participated agency-wide, so that's LA County and San Bernardino County, who participated in at least one of our programs or activities. There were about 300 individuals who self-reported that they were pursuing licensure. We had over 100 FFNs who expressed that they're interested in improving quality, even if they're not necessarily interested in becoming licensed. And for those that did want to become licensed, last quarter we had 35 FFNs who became licensed with the support of CCRC through the Child Care Initiative Project. And then lastly, we had 44 FFNs in the last quarter who participated in our play groups and story times. So those numbers are really encouraging to me and exciting, just because I know, prior, when we logged on early for the webinar, one of the things that we talked about was that prior to the pandemic, when we were doing things in person, we would have anywhere from we would have more people who registered for activities than would actually show up. Even though we still had good attendance, we still, it wasn't we had those that didn't quite make it. What we found now is that we've transitioned to a virtual platform, is that we're reaching more providers, more parents, and we've seen our attendance increase dramatically in our trainings and our activities. So my staff did a training, I want to say back in July, on the power of puppet play, and really talking about how to use puppets with young children to just talk about all the stuff that's going on, and just how to use puppets in general with children. And that training was full. I believe that we were at capacity. We had 40 attendees, and the waiting room was full with people asking and waiting to get in. And the best part of that is what we found after the training was that about 40% of the attendees were providers that we had never connected with before. So what we've learned from this is that, we can't wait to be back together in person with FFNs and children and parents. And gosh, I just want to hug my staff and high five them and tell them what a great job they're doing and have lunch with them again. But we also know that as we transition, and as time goes on, we know for CCRC, it's definitely going to be a hybrid model of in-person activities, but we're also going to keep this virtual service delivery component, because we've seen so many benefits in how many people we're able to reach.
You're getting all kinds of kudos too in the chat, and to New Mexico as well, and all of you, because you're all working hard on these types of strategies. So we should all kind of give each other a round of kudos. I saved one of the questions toward the end for both, I think both Alejandra and Jerry can reflect on this, and I imagine that other folks in the participant group can reflect on this too. The question came from Seattle, Washington, with the diversity of languages that are represented within the provider pool, particularly in FFN and family child care providers. We find this right across the country, that it's so reflective of the communities and the families themselves, that there is a lot of languages that are represented. Do you have any strategies or tips on sharing materials in multiple languages, especially some of those marketing or outreach materials?
Sure. So for CCRC, the primary languages on our service area are English and Spanish. So it's just second nature to us. Everything that we produce and develop is translated to Spanish. Internally, we do have staff that we can outreach to when there are requests for translation in other languages, that we can provide some support that way. And then the cool thing, I mentioned that network that we have in LA County through the Child Care Alliance of Los Angeles, and then we also are members of the California Resource and Referral Network. Both of those organizations do an incredible job of keeping us organized and connected and sharing resources and ideas. So one of the RNRs in LA County, for example, has a large Asian population. And so lots of their materials are translated into Mandarin and Hmong and different languages. So we, when there's a need, we can reach out to the other partners in our network for that support there. What we've learned at CCRC is that we used to think, okay, if we're gonna offer 4 of something, we're gonna do 2 in Spanish and 2 in English, and one of each in the morning and 1 of each at night, or something like that, because we wanted to make it equal and make sure that that's how we were doing things. What we've learned is that it's so important for us to practice active listening, and to really to listen to what the FFNs and just and parents, everyone in general, what really works best for them. And what we found is that even for some providers who are monolingual, their preference was really to attend playgroups and story time in English, because they wanted the children to be, you know, to have that exposure and that experience, and they wanted that for themselves as well. So in thinking about that, when we're staffing our events, you know, we try to have at least one bilingual facilitator in there, so that make sure that if it's in English, we're pausing and we're making sure that we're, you know, keeping the group together. So for us, that's something that we changed to recently. Is it's not a one-for-one. It's really, what are you looking, you know, what are you asking for? What do you need, and how can we support you with that? And then the books that, you know, when we give out books, we make sure they're bilingual, and do that as well. The last thing I wanted to add is that, you know, all of the stuff that we're talking about with FFNs, really what it comes down to is that you know, when I think about most children 0 to 5 are with FFN, 75% of FFNs are caring for on average 2 school-age children every day, you know, in America right now, or in our service area at least. So for me, this really reinforces and supports the facts that FFNs are an integral part of the childcare system, and that they deserve the same support and recognition as all other early learning and care professionals. And for me, whether it's thinking about language, or how do we offer things, or how do we outreach them, how do we do these things, it really starts with all of us remembering that when we ask ourselves in our respective agencies, you know, that question of what else can we do for families, that whether it's over Zoom or in a conference room, we need to go a step further and invite FFNs to the table. We need to get their input. We should be looking for opportunities to encourage conversation and actively seek their input. We should keep asking open-ended questions, things like, what questions do you have, versus are there any questions, where we're shutting it down with a yes or a no. What questions do you have? And then you pause and you just open it up and see what comes up. We want to incorporate their ideas and preferences whenever possible, like the language language piece that I mentioned. And then I just want to close by saying, if you can go to our last slide, you know, as you're looking at contact info, there's some really great resources here. How to find your home, R&R agency. There's a link to Sesame Street and Communities, to our website, and my contact info there. I just wanted to close by saying that whether you interact directly or indirectly with parents and providers, and you get to oversee, you know, the amazing staff that get to do that direct service, some of our most important tools, regardless of where we sit and what our role is, to me, it comes down to active listening, adaptability, and empathy. And it's really about all of us partnering, teamwork, collaborating together to come together, tighten our tool belts, roll up those sleeves, and really uplift and champion FFNs for their tremendous contribution to the field, to society, and most importantly, to remember that they truly are the experts on the invaluable work that they do, and they know their job best. There's so much that we can learn from them. So I wanted to close with that, and thank you all for listening. And then Gina, if there's any questions, or let me know.
Alejandra, did you want to jump in on that last part about multiple languages?
Absolutely. So I just wanted to share a couple of things that I'm sure it's for everybody, but in New Mexico, we're very proud that we're a very relationship-based state. So a lot of things are not so formalized in terms of procedures or forms. A lot of it is through the relationship process. And by that, we mean that, you know, like Jerry said, we have everything in English and Spanish, and that's just an automatic. Our trainings are in English and Spanish, but we do have population that speak other languages. We're very fortunate that we have our Assistant Secretary for Native American program, so we make sure that even some of our materials and some of our conversations are being translated into our different tribal languages, and with the collaboration with our tribal government entities. But in addition to that, we're also working with the refugee program that is helping us also understand the different languages that are coming to our state, that is not the typical languages that we have seen throughout the years. And it's helping us to be more responsive. Our childcare unit is working very closely with the refugee program to provide those resources that we were talking about, and helping do some outreach to families that normally may not know about these resources if we don't have those connections. And through those connections, then we're able to identify other families that may not know about our services and providing some training for them to be FFNs. I got to be on a situation, in my previous hat, right before this hat, I got to do some training to CSCFP home registered providers that some of them were interested in becoming registered, grandmas, aunties, cousins, and the level of interest and professionalism that they have when you come in to these particular settings, when you're providing formalized education for somebody that hasn't been in a setting for many, many years. It gives another level of understanding that professionalism and understanding that they are part of a bigger picture, even though they are the abuelita and the tia that are just providing the care in the home for 1 or 2 children. You're also helping them understand that that's their business. They are a business now. And they feel so proud when they realize that that's a business. And those tiny little things that you can do to connect, to have that relationship is gonna help empower such an important workforce, like Jerry said, that is really helping us move our system forward. And it was very sad to see that decline on numbers of registered homes, but we're very happy to start seeing a little bit, it's creeping up a little bit, and we will continue providing supports to them through our different resources, whether it's our CSCFP, whether it's our resources referral, our licensing team, and the whole department of early childhood education and care that is dedicated and breathing all the supports for our early childhood workforce. So I want to thank you, and thank you everyone on that is today here connected, because each and every one of us, with our knowledge, experience, resources, friendships, relationships, we were going to be able to continue moving our field forward. I think that when I started working in the field of early childhood, it was so lonely that I didn't think that nobody understood what I was doing. And it took me forever to explain to somebody what is it that I did. And now we have these opportunities to share resources, to talk to each other, to bring together a team of experts to recognize sometimes our population that is invisible, which is our friend, family, and neighbor providers. Thank you.
Thank you both, and thank you to everyone for being such active participants today. We had a really large crowd, which we're thrilled by, because it demonstrates how important and how dedicated you all are to this particular topic. And so we want to pay that forward and share, as Danielle hinted at, a big announcement at the end, and that folks should stay. I feel a little bit like a game show host now, like there should be prizes or something, and hopefully my announcement will warrant where we're headed. But it's sort of in the spirit of this idea that understanding and really retaining that family, friend, and neighbor is an essential part of our overall early care and education system. And so one of the things that BUILD is launching is a community of practice. And we want to offer out to anyone that's joining us today, if you're interested in putting together a team, it's a very quick turnaround. And this particular community of practice is starting as early as the first week after Thanksgiving. So it's very timely in that it's happening right now. So we know that this may not be the right opportunity for some of your states or communities, but if you feel like you could pull together a team of folks, that you have an area that you're focused on related to home-based childcare that you really want to try and make some forward movement on, and you think the COP could be an opportunity for you to step into that space, we want to offer out this community of practice. It's not the only time that we'll do communities of practice, so if you feel like the timing's not quite right, you're either not able to pull together a team this short of turnaround, or you're not able to start engaging in the work as soon as the beginning of December, then we will certainly keep in touch with other opportunities like this as they come. So don't feel like this is a one-shot thing by any means, but we wanted to use this particular webinar as an opportunity to share out the community of practice. And if you're interested, reach out to, and so it's on one of the last slides, there's email addresses, and there's an email for Danielle Fuentes Johnson. If you go ahead and shoot Danielle an email and ask her for the application, she will send you the application. And we are looking at folks to get their apps back by like Wednesday of next week. So you have a week, And if you're interested and you want to talk to Danielle and I a little bit about what that means, don't hesitate to reach out to us. If you're also not sure, should I apply right now or should I wait until 2021 for another opportunity? We'd be happy to talk to any about that, because we really do feel that this is a big peer network that we're developing, working on family childcare issues. And we know that the system level change and efforts are really important to continuing to move these forward. So we wanted to share that opportunity. Also, I want to share as another next step, our next webinar will be, it is actually already confirmed for January 19th. So if you want to go ahead and pencil it in on your calendar, we've not sent out the registration link yet, but it'll be January 19th at noon Eastern will be the next webinar. And at that webinar, we are going to be focusing more on shared service strategies, the concept of shared service kind of in its most broadest fashion, but then the particular couple elements of implementing that shared service approach to supporting home-based childcare and bringing in some examples of that work. So we're really excited about that event and wanted to get that on your calendars as well. Yeah, I'll go ahead and put Danielle's email in the chat so you all have that. The question came up again, whether or not the recordings are available, and they are available. If you follow the link to the website right now, you might find you get an error, but that's just a point in time. The link that was shared is the link where all of the materials for family childcare resources are, including the webinars that we've been doing all through 2020. So the previous webinars and materials that have been shared, and all of the different resources that we talked about today with our speakers, we'll also get those out there on that website. And as Danielle said, we can follow up with an email too if the website is going to be down for a little longer than we would expect. So apologize for the fact it just seems like we have a little blip right there. The website happens to be down in this moment while we're all together.
Yeah.
But hang in there with us.
Yeah. And Gina, I did go ahead and put my email in the chat box. Just verbally, it's dfuentesjohnson@buildinitiative.org. It's on that last slide. And I'll get that information on the COP and the application link to you as soon as possible.
So thank you all so much for today's discussion. It is so invigorating to be part of a dialogue where we're really unpacking these ideas of how we're supporting home-based childcare providers and all of the different elements of those providers within our states and communities. So we really value and appreciate you and all of your input, and we hope to continue connecting, and we will certainly see you in January if we don't connect beforehand. So thank you all.